Hello there, this is Dr. DeMaio, and we're doing part 2 of the lower extremities, knee and ankle. The knee, we're going to look at mostly the extensors of the knee and the flexors of the knee. The extensors of the knee include the quadriceps and the tensor fasciae latae. Some books include the gracilis. We are going according to Sieg and Adams for this exam. So these are the 5 muscles that extend the knee. The rectus femoris, the one muscle that crosses the hip and the knee. The vastus lateralis, the vastus medialis, the vastus intermedius, and the tensor fasciae latae. So we can do knee extension in an opened or closed exercise. Open chain allows for kicking type motions, and if you look at the image to the right, you see open kinetic chain. The person is doing leg extensions, the foot is moving up and out like a kicking motion. And then the closed chain are supporting the body. You look at the image all the way to the right. Under closed kinetic chain, she's doing a squat, and you can see that it's supporting the weight of the body, and it's using a closed chain because the distal extremity is not moving, but the body is moving. The rectus femoris is the unique muscle of this group in that all the other 4 muscles of the quadriceps originate on the femur. The rectus femoris is the only quadricep muscle that originates on the hip. So therefore, it crosses the hip, and it can also flex the hip. And also crosses the knee, so it can extend the knee. But all 4 of the quadriceps muscles will converge and insert at the patella, or I'm sorry, the patella tendon into the tibial tuberosity. Sometimes they call the patella ligament, and this time we're calling it the patella tendon because it's being utilized as a tendon connecting a muscle to the bone. But the patella is within that connective tissue, and some books call it the patella ligament. It doesn't really matter. Functions of these knee extensors, they all function best as knee extensors, but they do a simultaneous hip extension, kind of like the downward stroke of a bicycle. As you move it, the hip is moving a little bit. Okay, so the next is the knee flexors, and they include, of course, the hamstring muscle group, which is the biceps femoris, semitendinosus, and semimembranosus. And the sartorius can also flex the knee, as can the gracilis. And the gastrocnemius because it crosses the knee. The plantaris because it crosses the knee. And that tiny little muscle I put all the way to the right so you can see it, the popliteus. You can see the plantaris and the popliteus, and the gastrocnemius is cut in this image. The gastrocnemius does cross the knee. So the hamstrings do cross the knee, and they also cross the hip. So they cross both joints as well, kind of like the quadriceps did. On one muscle of the quadriceps, the rectus femoris. But the hamstring can cross both the hip and the knee and function best as knee flexors when the hip is simultaneously flexed. The plantar flexors of the ankle now. Moving down, and the plantar flexors of the ankle include, obviously, the gastrocnemius, the soleus, and then you're going to see this plantaris come back here again, that long skinny muscle. And then we're including the peroneal group, which is also known as the fibularis group. You have 2 of those muscles of the fibularis group, the fibularis longus or peroneus longus, and the fibularis brevis or peroneus brevis. And then, of course, deep is the tibialis posterior, and the flexor hallucis longus, and the flexor digitorum longus. All plantar flex the ankle. And plantar flexors of the ankle are important in occupational therapy because it's an important muscle involved in reaching above your head. So these muscles support the weight of the body and provide sufficient force so that an individual can stand on the balls of their feet when they're reaching high above the head. Dorsiflexors of the ankle, these would include the tibialis anterior, extensor digitorum longus, peroneus or fibularis tertius, and the extensor hallucis longus. The inverters of the ankle include the tibialis anterior and the tibialis posterior. That video is not functioning there. Okay, so don't even try and click it. It didn't work for me. Okay, the everters of the foot. Again, we have this peroneal group or fibularis group on the lateral side, and that is the peroneus longus, the peroneus tertius, and the peroneus brevis. Now, inversion and eversion are important because they help to stabilize the foot on uneven ground and allow the body weight to shift side to side. You know, as I was reading this and preparing this, I was thinking about when I was a gymnast and working on the rings. The rings move, so they call it the still rings because you have to keep them still while you're doing all these crazy things on it. And I can remember doing handstands and literally can control your whole weight just by moving your wrist forward, back, left, right. So it's kind of like what our ankles are doing. Imagine you're supporting yourself in not a handstand, but a foot stand. And the ankles are moving, you know, shifting your weight. And inversion and eversion help to stabilize the foot on uneven ground. So when you're walking, like I walked on my trail today, and the ground is uneven, that's good because you're actually working some of the other muscles that shift your body weight side to side. So they work below, inverters and everters, and then the upper muscles have to engage as well.